afternoon, ladies and gentlemen. Welcome to another week of discussion. This week I'm doing a voiceover because I have COVID and my voice is not so great, and I didn't want to do a video. So it's in the requirement I could do a voiceover, so I'm doing a voiceover for this assignment. Okay. Today we were presenting on contemporary theories. And this is a discussion, and I'm focusing on emotion focused therapy, known as EFT. And the course is Applied Counseling Theories. And of course, my yours truly, your presenter, Adrian Diapotorsky, PhD candidate. I attended Liberty University. And my professor overseeing this assignment is Dr. William Towson. And the assignment is due on June 9th, 2022. I found this poster to be somewhat related to my theory that I will be presenting on, and it reads, in the end, people will have a way of relieving who they are. You just have to give them the space and time to do so. No mask can be worn forever. This is something to think about as we proceed through the presentation. Now we have a diagram here, and it says thoughts create feelings. Feelings create behaviors, and behavior reinforce thoughts. Again, this is something we should think about and see how we can link it to the presentation. Now our agenda. Registration is being done and information packets are already collected. Learning outcomes. We'll have an introductory video presentation. Then we have the etiology of EFT. Then a 2-minute refreshment break. Then followed by a 30-minute mini lecture on EFT. Then we will have a culminatory activity, which will be done via a oral group presentation. Then we have our Q&A, which is an open mic. Learning outcomes. Number 1. At the end of the presentation, students should be able to define what is EFT clearly. They should be able to identify and explain 3 main stages of EFT techniques. They should be able to explain the usefulness of EFT to individual, couple, and family. Fourth, they should be able to list and explain 4 assumptions of emotion-focused therapy. 5, clearly articulate the goals of EFT. And finally, explain the role of assessment in EFT using 1 assessment example. Last but not least, provide a concise critique of EFT. Now we go into our introductory video.
EFT came about by me actually studying how people change in psychotherapy. And I began a process. I started off as a process researcher, but I was also trained in client-centered therapy, person-centered therapy, and in Gestalt therapy, and in psychotherapy research. And it was an integration of those, but within emotion theory. I started off as an engineer and then changed to psychology, and I came into psychology with the view that I knew more than I could say, that there was something going on, more than rational thinking and mathematical kind of thinking. And then I discovered that there was hardly anything in emotion. There were 2 books on emotion when I came in 1970 into psychology. started off with audio tapes and then video tapes. And I saw that people who got engaged emotionally changed more. And I also discovered that in my Gestalt therapy training, in my own personal work. So it was an integration of all of these, but within my emotion theoretical framework, which I've been lacking before.
Okay, guys, something wrong with my video, but I will proceed. This evening, the devil is indeed a liar. So, this introductory activity was to explain how emotion therapy came about. And this video was done by Les Greenberg. How he explained his studies and how people change in psychotherapy that led him to develop EFT therapy. But we will get back to this at a later date. So right now we will have our break. So there is refreshments, coffee, whatever you need, guys, you can take part. And the bathrooms are down the hall. So please make your way and get back here in 5 minutes. Okay, guys, bye. Okay, guys, so that was our 5 minute break. And now let's get into the etiology of EFT and what is emotionally focused therapy. Emotion focused therapy is classified as a temporary therapy. Typically, it is short term. It is used to improve bonding and attachment in both adults and individuals' relationships. This theoretical approach is heavily rooted in research on love as an attachment bond. It was also used with couples and was developed by Les Greenberg and Sue Johnson, both medical doctors back in the 80s. Again, this theory is currently being used in private practices, hospitals, hospital clinics, and training centers globally. Johnson and her partner founded the International Center for Excellence in EFT in 1998. Sorry. The center provides training for therapists or new therapists, which includes workshops, DVDs, autotapes, externships, and emotional focus therapy certification for trainers, therapists, and supervisors. The center additionally facilitates clinical research studies. According to Johnson et al. 2013, this theoretical approach focuses on emotions, since emotions are often absent from interventions, especially systemic intervention concentrating on relationships, while on the other hand, EFT was developed by Dr. Leslie Greenberg and Robert Elliott, who also focuses on emotion. This type of therapy is typically individual therapy, according to Johnson et al. 2013. Individual sessions are often the mode of therapy. The therapists work to assist the individual in analyzing and assessing their emotions and emotional reactions better to understand themselves. Johnson et al. 2013. This distinction symbolizes the difference between emotional focused therapy, which is most often shared in couples working to develop an understanding of each other emotions, as well as their own as a unit. Johnson et al. 2013. So guys, I see here where my producer is saying that we have another break. So we're going now into our 30-minute mini lecture. Here's Sue Johnson is a Canadian psychologist and the primary originator of EFT, which was developed in the 1980s, as I said before, and is currently being used in private practices, hospitals, and such. And we went over that, so I guess I was reading in, you know, backwards. Okay, guys, let me stop psychobubble. Now, the goal of EFT, this therapy aims to acknowledge the actual evolution of emotions so that it acts as a guide for human behaviors. Let's look at Gestalt therapy, which is often viewed as training in emotion awareness. This theory states that emotions were often blocked from awareness and from organizing actions by self-concepts, and unfinished business. The purpose of blocking was to avoid pain or undesirable emotions. So this was like a defense mechanism to prevent hurt, shame, guilt, all these emotions. Gestalt therapy has four major concepts. You have the biological field theory, an object of the individual, the need for contact and relationship, and the capacity for making whole. So we're trying to look on the individual as not a piece or a fraction of, but an entire whole, an entire being. We're looking at the whole holistic approach of the individual. All areas of their life contribute to these issues that they're having. And in order for us to meet or to help the client, we have to look on the client as a whole, as a unit, as a community. Now, even though the client-centered approach characterize feelings as the marriage of emotions and cognition, experiencing everything that is taking place within the individual at a given time or instance that is available to awareness is vital. So everything is happening in the person's life should take into consideration because they bring awareness, they bring information into the light, into the conscious. So we're going into the unconscious, taking out what is there, put it in the pre-conscious, then we have it into the conscious mind, the working mind. So we have, guys, many people always talk about the different type of memory, but we have working memory, we have a trained memory, and we have an untrained memory, but I will explain later. Now, goals continue. In this theory, the counselor, the therapist, learn about the emotional arousal caused by the problem, the challenge. In ordinary individuals, these emotions are handled and interpreted correctly. The occurrences of emotions, such as awareness of the arousal, apt interpretation, and appropriate expressive actions, usually completes the sequence. However, this is different in mentally disturbed or individuals who have psychological challenges. They tend to block they tend to block or blocks or obstacles prevent typical completion of this sequence. This is a fact according to the theory. So they have a neurological defect. So there is something that is not, some chemicals there is not working properly. So there is an issue there that's causing the block and the obstacles, preventing them to complete the sequence. So this is causing the disruption psychologically. For example, and I use this, if John were to avoid or disregard the emotional arousal, he would be in a predicament, in trouble. Now, this is where the counselor gets involved. He or she places significance on interpersonal processes and then emotional focus processes. The counselor role and action here are to exhibit congruence, meaning being what you're about, stood your ground, see that have your ground rules, your boundaries, your action matches what you are preaching. Empathy, meaning you are not offering sympathy to the client, you're empathizing, you're putting yourself in the client's shoe without losing yourself. An unconditional positive regard towards the client. So you, regardless of what issue is presented, it doesn't matter which religion, which sexual orientation, which gender, you see the person as an individual without judgment. Then he or she attempts to build a therapeutic alliance, which is in form of it's an attachment with the client, who begins to trust and follow the guidelines without any misgivings, without any problems. So when we go to a doctor, for example, we don't just go to the doctor and like, hey, but I'm just gonna tell you, I have unprotected sex. I have four sex partners in the past week. No, you're gonna reserve because you don't know this person and you want to build a relationship. But the person first, which is the provider, got to prove themselves like, okay, I'm trustworthy. I see you. I see where you're coming from, and I want to listen to you. And based on that, over a period of time, or maybe one or two visits, you start to open up and say, okay, this person is not so bad. Okay, I can let him in on what is going on in my life. So this is what we say a therapeutic alliance, because therapeutic alliance is so critical for the journey of any therapeutic process. Now let's look on some techniques. Changes occur through 9 steps, but we'll be looking on 3 broad stages that aid clinicians and evaluate progress. And those 3 categories are de-escalation. What happened in this stage? So this stage is focused on recognizing negative or undesired communication arrangements that contribute to conflict, identifying negative emotions related to attachment challenges, and reconstructing these challenges. This procedure facilitates the individual, couple, or family members to see and visualize how their insecurities and fears can negatively impact or harm their relationship. During the therapeutic process development, the client or clients start to view unwanted behaviors, not limited to an angry outburst or selective mutation, meaning they just don't want to talk for whatever trauma they're facing, malice, not speaking to each other, or social withdrawal, just withdraw from everything. I don't want to go out, I don't want to mix with my friends, I don't want to do anything. That is social withdrawal. Distorted, these distorted defense mechanism is a way in which they protest their disagreements or uncommunicated hurt. But these only prolong and feed into further maladaptive behaviors because these are unhealthy ways of thinking, unhealthy way of acting. So if we continue down a destructive path, what do you think is gonna happen? They're not gonna be helped. They're gonna just sink deeper and deeper and deeper. You're wrapped up, you're tied up, but this is not in Jesus. This is just in destruction, and we don't want that. So now the therapist acts as a coach to help the client learn how to become more emotionally present, being here and now, and be more empathetic and boost their interpersonal interactions by strengthening their attachment bond and allowing them to live in peace and harmony with each other. What is more great than in peace? My God, when you have peace, it's like you win the lottery because that's money can't buy you peace. So a peace of mind, trust me, it's just a lot. Techniques continue. Let's go to the next stage, restructuring. Now, in this stage, each party involved discovers how to share, express their emotions and demonstrate acceptance and compassion for one another. Through restructuring, individuals become more receptive to each other and their wants and needs, their desires. In addition, this process also helps them to decrease conflicts while developing a solid emotional bond. Whether in individual, couple, or family therapy, everyone everyone learn how to express their deepest underlying thoughts and emotions, knowing that they will not be attacked or judged to meet or to communicate their needs. So you have to create an atmosphere for them to express their deepest feelings. Because it's best when you can tell a person exactly how you feel without being attacking or aggressive, but through your eye messaging. John, I feel hurt when you did that. I didn't appreciate that because this is how it made me feel. But going forward, I would prefer if you do this than that. So you see, I communicate what you did, how I felt, and what I would prefer you to do next time in the event of. Moving on. The final stage is consolidation. The psychotherapist facilitates, for example, the couple to work on new communication tactics and practice skills, whether through role playing or the empty chair when intermingling. This process makes it easier for couples to see how they have been able to modify, adjust their behavior, and now see how new interaction patterns can prevent conflicts or unsolicited behaviors. Nevertheless, recent sequence of bonding connection occurs and replace old destructive patterns such as criticize, defend. Finally, new progressive cycles become self-reinforcing and generate permanent change, which becomes a haven and a healing atmosphere for both individuals. Again, this process, yes, for both individuals. Now, what can we what can we get, or what can emotional focus therapy helps with? Interesting question, but let me tell you. Emotional focus therapy is beneficial for couples, individuals, and family battling conflicts, anguish, or poor communication. While often used in couples therapy, this model can help individuals improve and enhance emotion-related difficulties. It can it can also help family members develop a solid, secure bond or attachment. Couples who might benefit from EFT comprises of those comprise those where one or both partners is okay. So couples who may benefit from this are couples who may one or both of them have a chronic illness, suffers from PTSD, post-traumatic stress disorder, any addiction, substance addiction, or depression, whether it's mild or severe. Gans et al. 2021 suggests that, based on research findings, EFT has proven to be a practical, theoretical approach for couples facing infidelity or other traumatic events, whether recent or in the past. Recent empirical research have shown that MRI studies demonstrate significance of secure attachment. Okay, let's look at some assumptions of EFT. Emotions Emotion is an inherently adaptive method that has developed to one support one to survive in an environment with others. We are in life, we need people. We need someone. No man is an island. No man stands alone. EFT proposed that I feel, therefore I am. And that feeling precedes thought processes, individual processes, and intrinsic, intrinsic propensity towards growth, maintenance, and mastery as a part of their development process. Emotions influences behavior. Now you see in my first and my second slide, those three circles, now you see where they are making sense. Emotions influence behaviors and affects thoughts, but the probability of becoming problematic due to past experience or trauma, skills discrepancies, those that you weren't mastered according to Erickson, or emotional abstention. Emotional change is essential for cognitive behavioral transformation. Now we see CBT coming in play. Even though conceptual and experimental knowledge is different, individuals are smarter than their intellects alone. Now we're going to look on the role of assessment in EFT, and I'll be using one example of an assessment looking on the functional assessment. Given that I work part-time as as a ABA therapist, I want to use the functional assessment in this one. Eminent psychoanalysts have researched and evaluated their findings and discovered that emotional factors played a vital component in psychotherapy. Functional assessment The functional assessment idea is an assessment-based approach to psychological therapy and is strongly correlated to behaviorist practices. Psychotherapists and other clinicians, like myself, have been using assessment-based therapies, relying on sequences for decades. Such assessments includes but not limited to CBT, cognitive behavioral assessment, emotional focus therapy, system focus model, and the psychodynamic therapy to help the mentally disturbed in our society. Clinicians consider the client's presenting problems, the, pre- the precipitating factors, the predisposing factors, and the perpetuating factors, and protective factors for functional assessment. So again, we're looking on the client as a whole, as an entire system, an entire unit, not just a fraction or a piece. In the chain of events, the client may be experience a predisposing factor that can trigger his or her, I should say, psychological distress and create a presenting problem. The psychotherapist will realize the client with the problem, research the case, and develop an intervention around the continuing factors and the defensive factors, given the emotions, given that emotions are not given much regard in this at this point. So, for example, let me use an example. Say my brother calls me fat. I don't like, of course, I'm a voluptuous young man or woman, whichever one, but I don't like to be called fat. And whenever I hear the word fat, because I attach such negative connotations to the word fat, whenever I hear fat, I get angry. And when I get angry, I tend to smash things, destroy property, and inflict physical harm to others. So those are triggers. So whenever I hear fat, it triggers these destructive behaviors. So now the therapist will come and study, okay, so this is what causes John to get angry. So we're going to identify the problem, whether it's in the environment, whether it's a place, whether it's a thing, whether it's a situation, whether this is someone, those that triggers me. Now we're going to identify the triggers, whether it's one, two, or three, then we're going to describe them. What happened in these triggers? Describe them. You clench your fist, do you get flush, clammy skin, what happened? Heart palpitation, you get tachycardic, what happened? So we're going to identify those triggers, describe them, and then we're going to develop healthy ways. Now we're coming in with the reconstruction, healthy ways as interventions, how we can mitigate and or avoid or reduce these triggers when they arise. So we have to learn how to, because our body give us warning signs whenever we are triggered. So we have to learn to, the therapist will help the client become aware of those signals to know whenever those triggers are being activated. And then what is the exception? What we're going to do instead of acting out? What is the healthy way of doing? And then put those things in place. But also, what if you're in a situation where those you can't think of those strategies that you had created? What can you do in that here and now situation? So those are things that the therapist, the functional assessment is pivotal in getting those background information, doing the research, using evidence-based practices and strategies to help the client, to support the client through those challenges so they can develop some level of mastery or have some stability in place, a foundation in place to depart from those destructive behaviors. Okay, let's move on. Now we're going to look on the critique. We're going to critique the EFT therapy to the best of my ability, guys. Again, I have to condense this information because of time. Now, EFT is generally for couples. It is short term. It's a short term evidence. It is short term. It's evidence based couples therapy, and it was established on the attachment theory. Now, since the theory conception, effectiveness and efficacy research has accumulated to address a wide range of couples challenges. EFT meets or exceed the standard for classification as an evidence-based couples therapy drawn primarily for couples and family research. Additionally, EFT researchers have examined the process of change and predictors of outcome in EFT. Now let's look on the strengths and weaknesses of EFT because no one theory is perfect. No, no, not one. So we have to look on what weak areas where there is room for improvement. So let's look on the strengths first of EFT. The approach is based on clear, precise conceptualization of maternal distress and mature love, according to the Mental Health Academy 2010. Conceptualizations are substantiated by empirical studies on the nature of marital distress and adult attachment, according to the Mental Health Academy 2010. EFT is shared and respectful of the client's privacy, dignity, religion, sexual orientation, physical and psychological capabilities, while emphasizing a therapeutic relationship is essential for growth and development, according to Mental Health Academy 2010. And this is also in supportive of our APA guidelines 2017. Finally, EFT is all inclusive and applicable to many problems and cultural populations, which is great. Now let's look on the weaknesses. This theoretical approach is not perfect or suitable, and as such may not be appropriate for individuals who experiences more extreme challenges or psychological distress, according to the Mental Health Academy 2010, focusing on emotions and appears to disregard other behaviors that may add to the client's dilemma. So it only focuses on emotion, but what about the other other things that contribute? So there is a drawback, and this is one of the weaknesses of this therapy. Finally, EFT may be rejected by individuals that seeks or who seek psychotherapeutic in-depth in their therapy sessions. Summary: emotion focused therapy used in a triad. And why I say triad? Because it can be used with individuals, couples, or family members. It's from the perspective of the attachment therapy, McPhee 2021. The general ideology is that we often find ourselves buried with undesired habits based on insecure attachments or similar challenges. In other words, we get stuck at a crossroad where they are hurt and in pain. Couples usually hurt each other, according to Dr. David McPhee, a psychologist at the University of Minnesota. However, unlike other therapies, EFT does not require the client to have a diagnosis. This modality is about constructing skills for achieving new insight or treating challenging symptomologies. McPhee 2021. The Therapeutic Alliance allows both the client and the therapist the opportunity to deeply immerse themselves while tackling the here and now. Therapists tend to use an eclectic approach, not limited to psychoeducation, which is heavily based on this therapy, and psychodrama, which are vital ingredients to cognitively reshape and replace maladaptive behaviors with the desired ones. EFT is again short-term approach that generally takes 8 to 20 sessions before termination. McPhee 2021. Finally, EFT provides a space for new emotional experiences where the process is facilitated by an experienced and skilled clinician. McPhee 2021. Restating the goals of this therapy is to develop and create a secure and resilient bond amongst the couple slash family by enabling them the opportunity to express their emotions, normalizing the attachment needs of each spouse, preserve a neutral collaborative therapeutic relationship with the couples to foster emotional acceptance and create a shift in each partner's interactional stance, and initiate new phase of interactions. The counselor must be engaged entirely, unconditionally accepting, with positive regard, empathetic, and genuine to enhance personal safety and freedom for the individual, couple, or family to explore their emotions without barriers. The therapist also operates as a coach, directing the couples as they delve into their emotions. Various scholars have argued that this type of therapy is better suited for couples with moderately distressed who are moderately distressed. Another aspect of emotional controlling skills include recognizing and identifying emotions and accepting emotions, increasing positive emotions, and decreasing vulnerability to unwanted emotions. Greenberg 2006. Adverse emotions often express an attempt or intent to exclude the other. Therefore, destructive emotions are driven by an underlying fear of the unknown. And guys, we can agree. We often get scared of things that we don't know. You want to go to college, you don't know where the money is coming from, you don't know where childcare is coming from, you don't know how difficult the course is, everything. You're just fearful of the unknown, but you have to trust God and step out in faith. Anyways, keep it moving. A fear. Therefore, destructive emotions are driven by an underlying fear of the unknown, a fear of the action or of action of others, and the need to monitor them or present them to avoid being harmed. For example, apathy, grief, fear, disgust, shame, blame, disappointment, bitterness, anger, and resentment, according to the Mental Health Academy 2010. While positive emotions express an attempt or an intent to include the other, this is described by working on learning more viewpoints, intermingling more with others, and taking pleasure in making things better. Positive emotions are increased by an underlying desire for gratification and unity. For example, interest, passion, happiness, empathy, action, and even some inquisitiveness. Lastly, EFT assumes a perspective that change occurs through emotional awareness, control, change, and expression. Key resources to learn. Key resources that I've learned using this approach. Emotions are adaptive sources. From conception, emotions become a part of our neurological system. The neurological signals and pathways support how we communicate our desires and regulate interfaces. While on the contrary, unpleasant emotions assist us in conveying our discontent and attract others to comply interchangeably. Gestalt familiar with Eastern mysticism, mys- mysticism, and philosophies view emotion as a vital controller of human action. The individual is not seen in part, but as a unified whole. The interplay between biological development, environmental and impacts, the interaction of individuals and the environment, and creative modification are crucial features, or in short, The work of nature versus nurture, the yin and the yang. Now, counselors are viewed as coaches who work to improve EFT, emotion focus coping, by assisting individuals and couples to become self-aware, accept and make meaning of their emotional experience. Now, I would like to insert this into my presentation, and I hope you guys can learn something from it. So it's a deaf comedian who turns tragedy into comedy. Please spare me at least 3 more minutes, and I hope you can take something away from this presentation. And this video gives you that layer, that finishing touch for my theory. My best friend was a little Asian girl. She was blind. But every day we would have lunch together. She said these quick barbecue sandwiches. And I never even born when she was in charge. So every day we would exchange lunch. Now what I didn't realize as I got older, she never saw me abstain from lunches. But then again, I never had a complaint about it either. One of the first times that I good night as a child was good morning. And I gotta tell you, as a kid, I was so excited that I could communicate that the day of my family reunion, I went up to everybody and I sang, "Good morning." I guess you could say they're not morning people. When they found out today that everyone started giving me warning and I started learning how to talk, they thought they were sick because I was sick. They put me back to public school. I was in public school in fourth, fifth grade. I stole blood. I stole candy. I stole things from my house to take to school to get to the other kids because I wanted them to like me. So I'm in school, I'm so tired, but I feel good like that. But she's trying to be accepted. I want to be a part of something. Everybody wants to be accepted, a part of something. So I stole, and I would get stuff away. I couldn't understand anything in the classroom. Teachers would have their back up against the blackboard. I couldn't hear what they were saying. By the time one kid would say something, I go to look for their lips, another kid's lips were moving. I was totally lost. I graduated from high school for 1.8 years. I didn't know what to do with my life. I was so lost that some people used to say alone. So by the time I was 20 years old, I tried committing suicide 5 different times. Now, there are going to be some things I'm not going to be suicide for. But there's not a day that goes by where I don't thank God for letting me fail at least 5 different times. When I was 20 years old, I was laying on a beach somebody. Life got Jeep ran me over. Talk about not knowing what your job description is. The Jeep ran over my face, stomach, chest, side, and back. I was laid up for 5 years. I died at the scene of the accident. I saw myself today. At least I believe I did. When it happened to me, when the Jeep ran over my face, I opened my eyes and I saw the body of the Jeep. I could see the two radios coming at me. And all I could think about is I needed to protect my head. So I went to put my hand up above my head, and unfortunately when I did that, the railways took my elbows and took my phone. The next thing I remember, everything turned was beautiful blue, the blue I yet to see. I was totally surrounded by it. And then the brightest, brightest cloud came toward me. And all I could remember was, no, I'm not ready yet. This is better. I'm not ready yet. When I said that, everything faded away. And I saw the paramedics started looking at me. Waiting for 5 minutes. In and out of a wheelchair for 2.5 minutes. They said I'd never walk again. I figured I didn't do it. I got to earn that. When I started walking, one day I just packed my car. I was living in Cleveland, Ohio, and I started driving. I ended up at the Pacific Ocean. I looked at the ocean. I looked at the car, and I said, well, where am I going to find out? I ended up in California. When I was 27 years old, I got diagnosed with cervical cancer. Now, that's a while. You can laugh at. So I stood there. The doctor said, I have this surgery. I went in, I had this surgery. 6 months later, I get a phone call, Kathy, we didn't get it all. I didn't know what to do. I was in my apartment, pacing the floor. Do I have the surgery? Do I not? And then I spent the first 20 years of my life trying to find suicide. I finally died, and then I decided to stay. And now you tell me if I don't have the surgery, I have 6 months to run away. I have no family support. What do I do? Fine, a perfect shot of gold. Is society too me back to the Olympics and losing all the time? No, this is okay. I like this. I like this. So these people are really good. No, I don't understand. Just that she going back to public school. I don't understand the teacher. The teacher has a bad judgment. The kids are making fun. No. Now I'm going to be a realtor for my life because I don't know about Jeep. I have to find something like that. I don't like that. No. I want to give you cancer. I'm going to give you 6 months to get away. This is where I want to go with this. No. Hear this. How dare you say I cannot talk? How dare you say I cannot walk? How dare you say I cannot live a life? How dare me say happening to you? I decided to take control of my life, take charge of it, achieve my diet, achieve my attitude. I'm going to try to cancel for the 15 years. The gift of choice, the gift of giving so that nobody will take away from you. You have unlimited choices. If you make the wrong choice, you can try to correct it because another choice make it right. Your life is the most precious gift that we have. And it's the only one we have. You can live it as long as you will leave it alone. When you leave in between, it's a challenge of how you deal with your life. Remember, no matter how bad something is in your life, it has a time. And we know we can drag something bad on forever. But also remember, no matter how great something's going on in your life, that too has a time. Indeed, that was a 3 minutes worth it. Now, guys, we will take our group 1 and 2 um, oral presentation based on the objectives that was stated earlier on, and those information were in your packets. Okay, guys, so thank you for presenting all your information. Thank you so much. Um, each group really covered um, the objectives and what they have learned, and it blesses my heart to know that somebody learned something and can take something away and put this in their practice or apply this to their lives, you know. And this go back to my lingering question based on the last video. What choice have you made that impacts your life the most? And my next question is, life is short. Tomorrow is not promised to me, you, or anyone. So today is the day that you need to take a stance. Today is the day you need to make a choice. So if you have family issues, if you have relationship issues, whether with your spouse, whether with your children, whether with your families, whether with your friends or co-workers, today is the day you need to take a stand. Put your foot down, take a stand, and seek help. Repair those relationships, repair those bridges that you have burnt. Even if you were not in the wrong, please be the bigger person and forgive those as God forgave us 70 times 7 per day. So who are we not to forgive and to forget? As human beings, we often say, oh, yes, I forgive you, but I won't forget. Let it go. You're still having fragments of that bad memory, that bad trauma in your unconscious, locked away. But it always finds a way of spewing out into different things. So when you forgive 100%, forgive and let it go. Don't have any grease or any residue of it lingering. For what? You still haven't let it go. So first forgive yourself and then forgive others. So again, at what point will you make a choice? Whether it's to give your life to the Lord, whether it's to mend relationships, whether it's to make a career path, whether it's to get a goal, reach a goal in your life. But even if there's this goal to finish this degree, it's not easy. But still press. I have COVID, but today I'm still presenting the best as I can. I'm still making an effort, a choice. So please make your choice today. Last, I just want to thank everyone who attended and participated in today's presentation. We hope and trust that you find the information helpful and that you can incorporate the skills and techniques into your working style, your working ethic. However, due to time, the information was heavily condensed. And for this limitation, we encourage you as active learners. We highly encourage everyone to continue researching on the modality. And we have also provided you with some valuable resources in your information packets that you can follow and read in your own spare time. So again, on behalf of everyone here, I just want to say thank you and may God bless your soul and have a wonderful Memorial Weekend. Bye.